every working week is 5 days of surgery from morning till evening. Patients are coming from all over the world for different problems. Well, it is going in some good direction. It's much better, easier for these patients, for these people. Techniques are slowly developing. They're nothing much radically changed, but we are changing. Every planned surgery, reconstructive surgery, should be 6 months in between. This is simply the time that our tissue needs to mature sufficiently. With this, it's a very interesting point. We have, let's say, 2 stages of satisfaction, what I noticed in patients. First stage is, you need to come into their mind. You need to understand them really. Especially younger ones. They're under pressure just to do surgery as soon as possible. And for this reason, probably with all of these big rules, you need to wait for some time. They need to go slowly. They need to understand that they need to make. It's very unusual female to male patient to come alone. It's very unusual. They usually come with somebody. It's not playing a game. These are people's life. You can make them miracle by helping them, or miracle by destroying them. They are